Hi guys, welcome back. So in the last video we talked about the medical emergencies, and in this video we're going to talk about injury emergencies. So let's start off by just naming and describing some of the few types of wounds that we might encounter. So we have incisions, lacerations, and avulsions. So firstly we have incisions. So incisions are created by sharp objects like a scalpel or a knife, creating that straight, smooth-edged, regular-edged cuts. Lacerations, on the other hand, they have rough, irregular, and the edges are not as neat as incisions, and these are usually due to crushing or tearing forces. So they look like jagged wounds. Finally, avulsions. So avulsions go really deep, so they can go deep into the subcutaneous layer or even deeper. So this happens when like a part of the tissue is completely or partially torn away. So these kinds of wounds cannot be stitched neatly because a part of the tissue is missing. So now let's talk about the different sources of bleeding. So bleeding can come from either arteries, veins, or capillaries. So we can differentiate these based on the rate of blood loss or blood flow from that vessel and the color of the blood when it comes out into the surface. If we've injured an artery, the blood that's going to be coming out would be spurting, and this is because of the high pressure in the arteries, and the color of the blood would be bright red. If the bleeding comes from veins, then this will be like a steady, slow flow, and the blood would be a much darker red in color. And if the bleeding is coming from capillaries, again, the flow of blood would be quite slow. Well, a lot slower than that of the arteries anyway. And now let's talk about different types of bleeding. So we have internal and external bleeding. So internal bleeding is basically bleeding that we cannot see with our naked eye. We might need to use some special equipment to see, internal bleeding. And external bleeding is just any bleeding that we could see. Also, bleeding can be differentiated based on the severity. So there can be severe bleeding or minor or mild bleeding. So severe bleeding happens when great vessels in the body are cut or torn. This can lead to the patient being unconscious due to the loss in blood in such a small period of time. Mild bleeding or minor bleeding, on the other hand, is caused by small cuts or scrapes, and the bleeding in this kind of injuries can usually be stopped by applying pressure. So before I describe the steps that we need to take to address severe and minor bleeds, I just want to talk about two terms that are commonly used interchangeably, but they are not quite similar. We have bandages and we have dressings. So a dressing is defined as any material, any clean material that is applied directly onto the wound or to the cut to stop the bleeding. So examples of this could include like a clean gauze or a piece of cloth. A bandage, on the other hand, is a material that we use to cover or protect any injured parts of the body. It can also be used to keep the pressure on a wound by wrapping it around dressings, and this can also be wrapped around dressings, for example a gauze, to help hold that gauze in place. Right, so now let's describe the actions we need to take to control bleeding. So firstly, what we need to do is to verify that the scene is safe, and then we either get the first aid kit ourselves or ask someone to get the first aid kit for us. And once we have the first aid kit, what we do is we apply our PPE. And what we could do while we are applying our PPE is to ask the victim to apply direct pressure on the site where there is bleeding. And then what we do is we clean the wound or the cut. And then once the area is clean, what we need to do is to apply dressings. So we apply dressings directly on the wound, and we apply pressure on the dressing, either using the fingers. For example, the cut is here and I put the dressing on top, and what I do is to apply pressure with the fingers of my hands, or if it's, for example, here, then I could use the palm of my hands just to apply pressure. And what do you do if the bleeding doesn't stop? So what you do is just to put more dressing on top of the dressing that was already there and apply even more pressure. Once the bleeding stopped, or you can't keep the pressure applied onto that area, what you need to do is to apply a bandage around the dressing. For severe bleeds, we need to activate the emergency response system only if we cannot control the bleeding. So if the victim is bleeding a lot, if there are any signs of shock, or if we are unsure of what to do. And also if we suspect any other injuries, like injuries in the neck, the spine, or the head. If there is severe bleeding from the arms or the legs that we can't stop using direct pressure, we could use a tourniquet. Usually we can find pre-made tourniquets in the first aid kit, or if there's none there, then we could just make our own using a piece of cloth and a stick-like object that we can use to tighten the tourniquet. So how do we apply a tourniquet? So first of all, we again verify the scene. We go send someone to grab an AED machine for us if someone is available. If not, then we go grab it ourselves. And why do we do this? So if the bleeding is severe and if it's uncontrolled, then this can lead to more complications, and the patient might go unconscious if a lot of blood is lost. So it's better to be ready. And then after getting the AED or getting someone to get the AED, what we do is we get our pre-made tourniquet, or the ones that we just made our own, and we kind of tie it 2 inches above the site of the bleeding. And then we tighten it until the bleeding stops. We also have to note down the time that we have placed the tourniquet, and we leave it there until someone with more advanced training comes to help the victim. For smaller cuts and minor wounds, what we do is we just clean the area by using running water and soap, and then we just wrap a dressing around it. Or if necessary, we can use an antibiotic cream or ointment just to prevent any infections. Only if the patient or the victim is not allergic to this medication. Once we've applied the cream, we then put the clean dressing on and just leave it in place. The next type of injury that we might encounter is bleeding from the nose. So what we do in this instance is, again, we verify the scene, we get the first aid kit or ask someone to get it for us. We put our PPE on and we ask the patient to sit down and lean forwards. So why do they have to lean forwards and not back? So if they lean back, then that means that the blood might drain into their throat and they might aspirate from their own blood or they might swallow the blood, and that can lead to vomiting. So when the person is sat down and leaning forwards, what we could do is to pinch the soft parts of the nose like that to stop the bleeding. And if the bleeding doesn't, and if the bleeding continues, then we just have to press harder. We only have to activate the emergency response system if the bleeding lasts for more than 15 minutes, or if it's really gushing out of the person's nose, or if the victim becomes unconscious. The next injury is bleeding from the mouth. So bleeding from the mouth can be very minor, like cuts in the lip, the tongue, or the cheeks, which are easily accessible, or it can be more complicated and serious. So if the blood is blocking the patient's airway, or if there's a tooth that's gonna block the patient's airway. If it's like a minor cut in the lip, the tongue, or the cheeks, which are easily accessible, what we need to do is we need to again verify that the scene is safe. We need to get the first aid kit, and we need to get a gauze and apply direct pressure on the site of bleeding. But we need to call emergency response system. We need to activate this if, for instance, that there's a lot of blood and there's a risk of aspiration from the blood, or there's like, a tooth that might obstruct the patient's airway. The next type of injury that we need to be able to deal with are tooth injuries. So people with mouth injuries may also have tooth injuries, so their tooth or teeth may be broken or loose or completely knocked out. Teeth can be a choking hazard, so we need to be careful of this. So what we do is we again verify that the scene is safe, we get the first aid kit, we put our PPE on, and then we just check what the situation is. So is the tooth chipped? Is it loose, or is it completely knocked out of place? If it's just chipped, we just need to clean it and call the dentist. If it's loose, then we encourage the patient to bite on a piece of gauze to keep the tooth in place, and then we call the dentist. And if the tooth is completely out, what we need to do is to keep the tooth out of the person's mouth, to actually take it out, and we hold it on the crown and not the root. So we can keep this tooth in solutions like egg whites, coconut water, or even whole milk. And what we do with the victim itself is we can encourage him to apply pressure on the empty tooth socket using a clean gauze. We then take the victim with us and their tooth to a dentist or the emergency department. We also need to be able to deal with eye injuries. So signs of eye injuries including obviously pain in the eye, swelling, bruising, redness. So what we do is to verify the scene, ask someone to get the first aid kit for us, or we can get it ourselves, put PPE on, and if it's like an irritant, like, I don't know, sand or chemical that's been in contact with the patient's eye, then we could encourage the patient to wash their eye with lots of running water. If we don't have that, then we could use saline or contact lens solution. And if you're like in a chemistry lab, or for instance, they have like a special eye wash station where the victim can wash their eye to get the chemicals out of their eyes. We have to activate the emergency response system if the object didn't come out, if the patient or if the victim is in extreme excruciating pain, or if the victim is having problems with their vision. Last but not the least, we need to be able to deal with penetrating and puncturing injuries. So for instance, someone got stabbed by a knife. What we do if the object is stuck there, like for instance they got stabbed here, if the knife is stuck there in place, we leave it there in place, because taking it out would lead to more bleeding and more damage. What you do is again verify that the scene is safe, ask someone to grab the first aid kit or get it yourself. If PPE is available, then put PPE on. And then what you do is to try and encourage the victim to stay still, keep them calm as you wait for the emergency medical services to arrive. And you can address any bleeding that you can see, but do not take the object out from where it is. Just leave it there for someone more with more advanced training comes along and takes over the situation. Now let's move on to some environmental emergencies. So firstly, we need to discuss animal bites. Animal bites may break the skin, bleed a lot, and become infected. So usually bites that don't break the skin are not serious. We really need to worry about if the bite breaks the skin. So we need to keep in mind that there is a risk of rabies from dogs, wild animals like raccoons, skunks, foxes, and bats. So what we need to do is we need to verify the scene, we need to get the first aid kit or ask someone to get it for us, apply your PPE, and we clean the wound with lots of running water and soap if available. And then we stop any bleeding with pressure and with clean dressings. And if the bite breaks the skin, we have to call emergency response services, because we don't know if they're at risk of getting any infection or rabies, as I said earlier. If there's swelling around the area, what we could do is we can apply a bag of ice and water wrapped in clean towel onto the site of injury for about 20 minutes. So how do we deal with snake bites? So first of all, we try to identify the type of snake if we can, based on its color and the bite mark. If we can't identify the type of snake, then we'll just assume that it's poisonous. Some of the signs of poisonous snake bite include pain at the area where the victim has been bitten. That gets progressively worse. The victim might feel nauseous, might even vomit. They may be sweating and they might feel weakness as well. So what we do is we verify that the scene is safe. We get the first aid kit or ask someone to get it for us. We apply our PPE if we have PPE at that scene. And then we ask the victim to stay calm and encourage them not to move the area of injury. We remove any tight clothing or jewelry, and we wash the area that's been bitten with lots of running water and soap if available. and we have to call the emergency response services. And we need to stay with the victim until the medical services arrive, just in case they become unconscious. The next environmental emergency that we need to be able to deal with are insect stings, specifically that of bees and spiders. Usually insect stings cause mild pain, swelling and itching in the area, but some can be fatal. So an insect sting can be serious and fatal if the victim has a severe allergic reaction to the sting. Also, if poison or venom is injected to the person by the insect. What we need to do is, again, we need to verify the scene, go grab the first aid kit or ask someone to get the first aid kit for us, apply our PPE, and if we suspect allergic reaction, then we ask the patient or the victim if they have an EpiPen. If they do, then get that out and we just use it, or give it to the victim and ask them to use it if they know how to. So bees are the only insects that leave their stingers behind. So if it was a bee sting, then what we need to do is to scrape the stinger out and the venom sac out without squeezing the venom sac, because that's just going to release more poison and venom. We wash the sting area with lots of running water and soap, and if there's swelling, then we can use a bag of ice and water wrapped in a clean towel. We need to stay with the victim for at least half an hour and watch for any signs of anaphylactic reactions. Some of the signs of poisonous spider or scorpion bites include obviously pain at the site of the sting. The victim may have muscle cramping, muscle weakness, headaches, nausea, vomiting, a fever, breathing problems, and even a seizure. So to deal with a poisonous spider or scorpion bite, what we need to do is to verify the scene, ask someone to get the first aid kit and AED for us, or we could get this ourselves if it's safe to leave the victim, and then we apply our PPE if necessary or if we have any, and we call the emergency response services, because again, these are poisonous creatures, so we need to deal with the venom or the poison. We then wash the sting area with lots of running water and soap, and if there is bruising or swelling, then we can use a bag of ice and water wrapped in a clean towel, and then we stay with the victim until the emergency response services arrive, just in case the patient may turn unconscious, and in that case we need to be prepared to deliver high quality CPR. Finally, we need to be able to deal with tick bites. So ticks are sometimes harmless, but sometimes they can also carry diseases, and they attach to exposed parts of our bodies. So when we see a tick on a person, then we need to remove it ASAP, because the longer we leave it there, the greater the chance that that person will get the disease that it's carrying. So what we need to do is we need to verify the scene. We need to get the first aid kit or ask someone to grab the first aid kit for us, apply PPE if we have any, and then we use a tweezer to pull the tick straight out from its, we grab it on its head or its mouth, and then we place it in a bag. We place it in a bag just in case the victim needs it to get medical care. We try avoid pinching the tick out, so always use tweezers. And then after that, once we get it out, then we need to wash the site with running water and soap, and we try encourage the victim to see a healthcare provider.